Hi, everybody. Judy Seeger here, your host for the Frontier Ozone 3 conference that's coming up in Santa Barbara, California with Dr. Mark Weiser. We are very excited to be able to present to you some of the speakers that will be at the conference who are coming in from all over the world. And today's guest is no exception. Dr. Eduardo Colin is going to be coming in from Mexico and speaking with you a few minutes today and just telling you a little bit about how he has found ozone therapy to be so beneficial in his practice. So Dr. Colin, thank you so much for being here today.
Hello, thank you for this opportunity for me to tell everybody something about ozone therapies. And I am very happy to be here with you, and I hope you to be there at Santa Barbara.
Fantastic. So yes, and we're so happy that you have a few minutes to share your experiences. But first, I want to introduce you to everybody who's watching. You graduated from the Veterinary School of National Autonomous University of Mexico. You got a diploma in ozone therapy in Gerontology and Longevity Institute of Mexico. You've been working as a horse practitioner for over 23 years, and I'm very excited to speak to you about your expertise with the horses. You've also worked in regenerative medicine in horses since 2009, including ozone, prolonged therapy, PRP, so lots and lots of experience in using ozone therapy. You were also a FEI official veterinarian as a veterinary delegate for the jumping and events. So even if you don't know much about horses, these are the high-end horses. And so, of course, we know that everything has to be perfect for them. So we're going to pick your brain a little bit about that. You're also a lecturer in national and international meetings in veterinary medicine ozone therapy in Mexico, Cuba, Chile, Italy, and the United States. And you're the co-founder of the Ozone Vet Clinic group dedicated to regenerative medicine and equine medicine. So very excited to have you on here and share your expertise. So first of all, Doctor, how did you get into ozone therapy for your practice? What was it that got you into it?
Well, one time when I went with my traumatologist, he loves horses, and he asked me about if I have heard about ozone, and I just answered no, I have not heard about it, and he just told me, please read about it. Then some days before, after that interview with my traumatologist, another doctor asked me about ozone, and then in the same week, one trainer there in the racetrack in Mexico was talking with the owner of a horse, and a man who has some machines. He's not a doctor, but he has some doctors, and they develop ozone therapies. He told the trainer about ozone. Then that trainer went to the racetrack and talked to the official veterinarians in order to ask them about ozone and if they could develop that technique in that horse. Then the official veterinarians called me in order to make all the therapies, because they cannot develop therapies as they are official veterinarians, and they needed a clinician, a clinic or clinician, a veterinarian. So they called me, and I talked to them in order to know what is ozone. He explained me about everything about ozone, and we started to work, but I was very scared about it because I didn't know how did ozone work. So I had to read, I had to had an interview with human doctors in order to tell me what about or how ozone works. Then we could transport or take the human techniques to the horse. That horse was very bad because that horse was on the lowest level on the racetrack, and the owner wanted to raise the horse with the highest level horses there. Then we made the major autohemotherapy to the horse and rectal therapy to the horse, and that horse won the second place in that race.
Wow. So from going to last to second place in one treatment.
That horse had never raced, you know. I mean, he competed, but he never won any race. So we made 2 autohemotherapies and 3 rectal therapies in a week, and the horse won the second place.
Okay, so in 1 week, that was the difference. And you used MAH and the major autohemotherapy, and then the rectal insufflation, you used both.
Yes, I started with the major hemotherapy on Monday, then Tuesday, Wednesday, and Thursday rectal therapies, and Friday again the hemotherapy, and the horse competed on Sunday. So we had 1 week in treatment, and the horse got the second place.
So in your practice in working with these horses, which you've been doing, you said, for 23 years, what are all the different ways that you have found to be the most successful that you are using with the horses?
Well, as a normal or typical veterinarian with allopathic medicine, and as I never known about ozone, I was treating horses with corticosteroids or hyaluronic acid or the conventional medicine. Once I knew about ozone, I became to use ozone instead of the typical or traditional medicine, and I saw a very, very high difference in the recovery times. And the most important thing that I think it's the quality of the recovery, the quality of the tissue, you know, because when, for example, when a tendon or a ligament have an injury, with the conventional medicine, we get scar tissue. But with ozone, with prolotherapy, or with PRP, we can get the same tissue of the tendon or of the ligament. So this is the most important thing that I can tell you, that the ozone can be compared with traditional medicine, because the quality of the tissue is the same before and after the injury.
Wow. And so that's a big difference. If they could recover more quickly, then that makes a difference for them for the next race. These are all race horses, or you also did special event horses with jumping and that?
Well, I have used these techniques with race horses, with eventing horses, show jumping horses, endurance horses, and the difference between the recovery times is absolutely wide. I mean, with conventional medicine, a tendon or a ligament that can be recovered in 10 months or 12 months, I have recovered them in 7 months, you know? So it's amazing the time, but I repeat you, the quality of the recovery of the tissue is the best thing that I have seen.
That's fantastic. So, Dr. Colin, you have been at this conference before. Yes, you have been there. What have you found to be the most helpful coming to this conference?
Well, assistants can learn some techniques that maybe they won't see in other conferences, because we have our own techniques. For example, for laminated horses, for the pain on the back, for corneal ulcers, and we have developed amazing techniques, and we are going to show you, and we are going to teach you there at Santa Barbara in this year.
Wow, that's fantastic. So they get to learn from you, they get to ask you questions directly, and they could ask you the results that they are looking for in their practice. So that's fantastic. So you would encourage the doctors to come to learn, to share, and to really understand how ozone therapy works in their practice, yes?
Yes, I like this conference because we are very close, teachers and students, and we can change our point of view. We can ask, we can answer, but also students teach us, you know, because sometimes students have their own techniques, and they are very, very useful for us in order to have several techniques in our practices. So this event, it's very interesting because the group becomes a very good environment, and we can, I mean, it is not teacher and student. We are all friends. We are all veterinarians. We are all therapists. Even the therapists that have made the ozone, and some other that haven't made anything about ozone, but once they learn the techniques that everybody teach there, they go very happy.
That's fantastic. So yes, and I appreciate you sharing that, because that's a very important aspect of these conferences. Many times you just go there, you learn, you listen to the lecture, but you don't actually get to interact with the teacher and learn, so that when you go back home, you can practice. So that's a very important point. Thank you for sharing that. So, Doctor, we will see you at the Santa Barbara conference. And those of you who want to learn from Dr. Colin and all the other speakers that will be there, we do have, like I said, from all over the world coming in. Go to register at the ozonetherapygroup.com and make sure that you spend the time with the quality doctors who could show you how ozone therapy could benefit your practice. So thank you, Dr. Colin. We will see you at the conference, yeah?
Thank you much. And of course, we are going to be there, and we hope many veterinarians to be there, and we hope to share and to learn and to teach each other a lot of. Okay?
Fantastic. All right. Thank you so much. See you there. Bye-bye.
Thank you very much.